Hi, I'm Brian Duncan, and this is Sean Kennedy, and we're excited to be here today on the Facebook Live edition of UT Orthopedics. We're here today to talk about shoulder warm-ups and strengthening workouts. Sean, you want to introduce yourself?
Yeah, like Brian said, my name is Sean Kennedy. I'm a research physical therapist at Ironman Sports Medicine at the Medical Center, and also work in conjunction with the Upper Extremity Center of Excellence with UT Ortho, Dr. Conway, and the other physicians that are part of that group.
And like I said, I'm Brian Duncan. I run our Shepherd Square Performance Center, and I also lead our Division I fellowship in conjunction with the University of Houston, and have the honor of collaborating with Sean and the Upper Extremity Center of Excellence. And like you said, Dr. John Conway and a group of upper extremity docs that have impressive resumes, and we're looking forward to kind of continuing to publish in that area. And real quick, we'll do a plug for next week on growing injuries, injuries in the growing athlete by Dr. Jessica Traver and Dr. Alfred Mansour. So again, today we'll start up with talking about shoulder warm-ups. So why even warm up? Sean, what's your thought on why do we even warm up? My dog doesn't warm up when I take him out for a walk.
Oh yeah, right. A lion doesn't warm up in the jungle. That's a great question, and something we get quite a bit. So there's multiple reasons why we want to do a warm up, and some people kind of look at us a little weird when we think about almost a total body warm up when we're even talking about something as specific as the upper extremity or maybe the shoulders in general.
Right.
I mean, one of the biggest bases that we cover is that we're going to elevate our heart rate and our body temperature from a local standpoint, instead of just diving in and going into any type of, throwing motion or overhead weightlifting, anything of the sort like that. So that's kind of the basis of where we start in terms of just getting our heart rate elevated and our body temp up.
Right. And then to kind of piggyback on that, as we do that, we're preparing the nervous system. So as we want to do things that require absolute strength or speed and power and those kind of things, we need to prepare the nervous system as well. And so heart rate and nervous system are the biggest reasons to warm up. And for aging athletes like me who don't want to pull a hammy sprinting to first and beer league softball, it's super important. So for kids, obviously they wake up a little more ready to go, and the older you are, the longer you're going to need to warm up, and more investment you're going to need to spend in those areas.
Well, again, to piggyback off your point about the nervous system, I mean, the muscles obviously that we're thinking about and talking when we're looking at these shoulder warm-ups and strengthening exercises are the big movers that we're doing, right? But behind that, something's got to be driving that, which is the nervous system. And to your point about more of the immature athlete or the youth athlete, is they still have a very, let's put this way, our nervous systems are always developing, right? Even as adults in beer league softball, but especially those kiddos, their nervous systems are really working on coordination and fine-tuning kind of the firing mechanism that happens in the central nervous system as our body's coordinating movements, whether it's an athletic movement like sprinting or something as simple as doing, an overhead shoulder press. So, I mean, that's a very great point.
Yeah. So, and so do you like dynamic or static warm-ups?
I think it's one of those really great depends answers.
Absolutely.
I think you can make a small argument for both. Overall, we've seen a trend into more dynamic workouts or dynamic type warm-ups, because again, that talks about kind of that constant active movement where we want people moving, elevating the body temperature, getting the nervous system primed and ready to go. Mm-hmm. There are some points though, I think over the years people have started to give static stretching or kind of that longer hold, lower intensity stretching a little bit of a bad rep.
Right.
A lot of the evidence points to maybe that we want to do that more towards the end of a workout to help recover and help gain some range of motion there. But there's definitely some instances, especially when we think more about highly specialized athletic populations, where that may be appropriate.
Yeah. I think to your point, trying to use something dynamic to get the body warmed up, to get you sweating, to get your nervous system activated, and the patterns that you're going to use in your sport. So again, these will be sport specific, and you'll see it coming up in the Olympics with all the swimmers standing on the platform, right? They're both swimming in the warm-up and cool-down pool at less than max intensities, and they're stretching their shoulders both dynamically, as you probably remember from Rio, Michael Phelps, swinging his arms in a circular manner, everybody being like, how do his shoulders not pop out of socket? But you've got to have that mobility to pull off these swim strokes. And so the combination of both is really the answer. And static stretching is particularly important to make sure that you keep and maintain the range of motions necessary for the activities you enjoy and the sports you want to perform well at. Anything to add to that?
No, the only thing I was thinking is you mentioned a few that if you look at some of the literature on kind of doing a static stretch before a more powerful movement like a sprint or a max vertical jump, and
Right.
looking at someone who did a dynamic warm-up, typically that group that does a dynamic warm-up is going to have a little bit better of a performance in terms of how high they're jumping, how fast they're sprinting. And I think even there's
Yeah.
there's a little bit of a deleterious effect of a static stretch where actually they saw that performance decrease from what their baseline is,
Right.
depending on the movement they're executing.
Yeah, no, good point. Good point. Yeah, prolonged stretching prior to a maximal movement is gonna kind of have a short term deleterious effect on your performance. So like a max bench or like a vertical jump. And so, good point. And say we're recovering from a workout, how long might you hold a static stretch?
Typically, we want some combination of anywhere from 2 to 3 minutes. So if you're stretching your hamstrings, even if it's not a constant 3-minute hold, something where you're doing 60 seconds 3 times, 30 seconds 6 times, somewhere in there. Most of the recommendations and the evidence there is kind of looking at that 2 to 3 minute time frame to see at least a short-term change in the motion you're trying to gain through the static stretching.
Yeah, absolutely. And so maybe now we'll switch a little bit. I kind of mentioned swimming, but also we're kind of in the middle of select baseball season or tournament seasons, and Little League World Series will be coming up in August. And so, can you tell us a little bit about motion? You know, there's the warm up stuff that we'll see in little leagues, but also can you tell us kind of how the shoulder range of motion changes over the course of a season?
Yeah, of course. That's a really important topic and something that we look at a lot when we start thinking of the literature as it pertains to preventing youth baseball injuries or any baseball injuries for that matter. And so this is an area of sports medicine that's rapidly developing and evolving,
Right.
just like ACL research started, in the 90s and the early 2000s. So what we've kind of seen in the past 1 to 2 decades is this terrible, terrible word that a lot of parents and a lot of athletes know is called GERD, or glenohumeral internal rotation deficit. Even to the detriment where that's actually sometimes put on a diagnosis as that's
Right.
the thrower's issues, that they have this detrimental loss of internal rotation. And there's a lot of different things that go into that. We think about the bony structure, so what happens actually at the bony level with some changes we see in the shaft of the humerus. The soft tissue structures, so we think more of some of the musculature surrounding the shoulder joint, and then also the capsular structure. So we hear a lot about posterior capsule tightness in throwers too, which is definitely something to contribute or think about. But all 3 of those things can contribute to what we see in terms of rotational range of motion, meaning external rotation reaching back, internal rotation coming down. What we've seen over the course of the years is when we start looking at studies that show associations between range of motion losses and injury risk, whether it's at the shoulder or the elbow, is we've actually seen a little bit of a trend towards focusing on the athlete's total range of motion. And then even more recently, we're actually starting to see more athletes that have external rotation loss, not necessarily contributing, but making associations between injury and athletes who suffer some external rotation loss. And part of that reason we've kind of made that shift is because of some of those bony adaptions I mentioned.
Right.
Athletes have this profile from an osseous and a bony adaptation standpoint that they actually should have a little bit of less internal rotation and more external rotation on their throwing limb compared to their other side. So when you look at it side to side, and you have an athlete that's here on their right side and there on their left side, it'd be very easy to blankly look at them and say, "Oh my gosh, they're missing so much motion."
Like right here, like why didn't that?
But you can't stretch bone, right?
Right.
That's part of their genetic makeup. I mean, that's partially genetics, and it's partially some of the physiological demands that the throwing motion has on the athlete that's caused that bony adaptation.
Right. All right. So we've been talking about shoulder range of motion, and I've had more mature high schoolers ask me this. I've had parents of 10 and 12-year-old select league baseball players, or just who are participating in the spring leagues, and they ask me about, we're always stretching internal rotation, whether it's across the body or here, and we're worried about that, but kind of speak to us about the bony kind of things that happen, because my left arm, my off arm only goes back this far, but my throwing arm lays back a lot farther. But on the flip side, this one goes down almost to 90 degrees, and this one's stuck here. And so will you talk us through, like, is that do I need to just stretch more, or is it my bone that's adapted to throwing?
That's a great question, and that's what we were kind of just starting to hit on a little bit there in terms of that bony adaptation, which is something that we can't change or revert back to the way we were. So what we're looking at there is we're looking at essentially a rotation in the humerus, which is the arm bone, which naturally occurs. So as we grow naturally, our humerus bones kind of grow inward that way.
Mm-hmm.
What happens when we see, especially when we see younger kids, as they start playing baseball, at T-ball at 3 years old, 4 years old, 5 years old, and continue throwing throughout their adolescent years when they are growing, is that repetitive stress of reaching back into that cocking position for throwing places stress on that bone right near where those growth plates are open, so that allows that bony change to occur, which is really important to consider when we are thinking about that discrepancy in your range of motion.
Right.
Now, that particular growth plate typically starts to close around 14 to 16-year-olds, so that's something that's important to consider, especially in an adolescent athlete, and especially if you're thinking as more of a medical provider too. You see a kid when they're 8 years old and you see them back when they're 16 years old. There could have been some changes in that time outside of the soft tissue changes that are happening as they grow, gain muscle mass and some bulk and whatnot naturally through puberty. But then also as they continue to throw for the past 8 years, that can be further changed since then. So what we really see is that kind of compensatory gain in external rotation, which is completely necessary and almost a competitive advantage for a throwing athlete, and the loss of internal rotation, which again sometimes can be part of a pathologic process, but not as much as we kind of used to think about.
Right. No, I think that's a good point. And to kind of stop you there. So if you grow up not throwing a ball, right, then you're not going to get this difference in range of motion. Mm-hmm. So if maybe your sport is soccer and you're all in on soccer and you really don't have time to play other sports, that's okay. But when you go to throw, your arm is not going to lay back as far because your bone wasn't forced to adapt while those growth plates are open. And so, and there's a challenge to that because if you take up baseball later, it may be good because you don't have as much mileage on your arm. Mm-hmm. But if you haven't thrown at all, that may limit your velocity.
And it might. I mean, that would be such an indirect thing to measure.
Right.
And there's little evidence that looks at kind of that difference between throwing age, how much of that bony adaptation someone has, and what that actually means. And so the jury's still kind of out on that. We're not quite at that point yet where we can make drastic conclusions, but theoretically, yes, that could be a bit of a competitive disadvantage at that point. But like you said, at that point too, there's less stress overall on that shoulder and elbow compared to someone who's been playing for 10 years already.
Right. And maybe if we kind of talk about a little bit more about our throwing sport or even swimming to put that in there because it's got a lot of demand on the shoulder. Do we need to rest? Do we need to take time off? What does the literature say? What's maybe the logic behind it?
Yeah, and there's so much going on right now, I think, in terms of the performance side of baseball, which I'm not going to go into deep processes with since we focus more on the injury and the recovery side of that. Generally, the recommendation is taking at least 2 months off from throwing. So you got a kiddo or some friends that are just diehard baseball athletes. They play on 2 or 3 teams throughout the year. The general recommendation is taking a couple months off of throwing. Not only just taking a couple months off of throwing and sitting on your couch for 2 months and doing nothing, but especially with our younger kids, we actually want to encourage them to play different sports. Just from an overall athletic development standpoint, you can read articles, you can hear stories about people like LeBron James and Kobe Bryant, all these different people who are obviously, Hall of Fame NBA players, but they tracked, they played, football, they did all these different things until they got to that point. And so there is some evidence that points to the fact that early sports specialization or kind of only focusing on one sport at an earlier age can kind of predispose you or make you a little more vulnerable to injuries associated with that sport that you see commonly. So baseball, talking more shoulder and elbow injuries. Soccer, there's a pretty high incidence of hip injuries and adductor groin pain related injuries and things of that sort. So
so giving kids time away from their main sport is highly productive. And so we highly recommend it. And there's the physical reasons to do so. There's also the mental reasons. A lot of your best kids that are all-stars at 10 and 12 years old are not all-stars in high school, and they're not going pro, right? Because of burnout, or they fall in love with another sport or things like that. And so to parents with later maturing and developing kids, also please know that all this is going to evolve and change over time. So if your kids playing right field, just think of it as they're kind of saving their arm for later in their baseball career. And
Maybe.
and like baseball here in the South, swimming is pretty similar in that you can swim all year long, and so and swimmers notoriously swim through pain, and they don't tend to have the traumatic injuries that maybe a baseball player might at a more mature level, but they just have chronic aches and pains. And so parents, we couldn't, as a parent of 5, I couldn't encourage you more to diversify your kids' sports experiences. Most of the college athletes have done so, and then most of your NFL and pro guys have done so. It also helps that let's admit it, they have elite genetics.
Yeah.
So
there's part of that you can't modify.
Yeah.
Now, on the flip side of that notion of taking some time off, like we said, the benefits for a younger athlete, maybe your 6 to 12-year-old athlete, are still great, like you said, from a standpoint of just gaining and developing overall athleticism, which we can also go back and talk about the nervous system side of that, but we won't do that today.
Yeah.
I will say there are a lot of great performance-based groups throughout the country that are doing a lot of research on essentially how to integrate throwing volume throughout the course of a competitive year.
Right.
So obviously your higher volume time when you're actually playing sports in the spring or playing baseball games in the spring and the summer are going to be higher. But there is a lot of ongoing research on what's the appropriate volume during the off months. So that way, there is some logic to saying if you want to get good at throwing, well, you probably should be taking a solid 3 months completely off of throwing. So there is a way to do it correctly. It's just not at a point where we can officially recommend, hey, during those 3 off months, only throw 10 times a day or, whatever it is. We're not quite there yet, but there is a lot of really exciting stuff going on that's going to be coming down in the next couple of years of how to appropriately kind of dose throwing volume throughout the phases of a competitive baseball season.
Yeah, I completely agree, and thanks for bringing that up because what we will also see is those kids who have maybe spent their off time not participating in other sports and maybe a little too much couch time coming back, and then the ramp up back into sports is too steep, right? And so they go from not practicing for 2 or 3 months to 2 practices a week and 2 games a week, and then suddenly their arm hurts or their elbow hurts or their,
Yeah, and that's always something real interesting. If you look at the incidents and kind of the time of year that most UCL injuries happen in Major League Baseball, and then on the other side, in lower extremity injuries, football season, you see such a higher number of ACL injuries in preseason and mini camp, and then same thing with baseball in that April, May, and June. You see a lot more guys dropping out of the season to have Tommy John surgery and procedures related to elbow-related throwing injuries. So there is a very good point in terms of ramping up too quickly after taking time off entirely. So
all right, so now we're going to transition. So Sean and I are going to head out to the clinic, and we're going to show you some stretching, both some static stretches that we think will be helpful, soft tissue mobilization, right, like with the tennis ball or cross ball, and then some supplemental exercises to add around your already well-structured workout plan. So we'll see you in the gym. All right, so we're going to demonstrate a sideline shoulder stretch. So Sean's going to retract his shoulder. This is key here. And then he's going to cross his arms, and then he's going to pull. And by laying on this side, he's anchoring his scapula. And then you're going to pull and elevate this arm. Notice this hand is underneath the arm, and that's going to allow for a better stretch. And so he's just going to take it up till it's comfortable. And then you're feeling the stretch on the back side of the shoulder. And then he'll hold this for 30 seconds to a minute. And like we said, you want to get between 2 and 3 minutes of stretching on the posterior capsule to make a difference. All right, now we've demonstrated one laying on the ground. This is a great posterior shoulder stretch if you need to stand up. So Sean's going to get his arm up to 90. Notice the elbow is as high as the shoulder. And he's going to anchor his shoulder blade on the wall and retract. And then he's going to couple his arms together and then pull off the wall. And he's going to, again, hold it for 30 seconds to a minute, getting in 2 to 3 minutes of total shoulder stretching. You want to feel the shoulder stretch in the back, and it shouldn't be pinching in the front. All right, now we're going to show you a pec stretch. This is a stretch that's often done maybe ineffectively or less well than it could be to pull off what we actually want to accomplish. So to show them. So we're getting the forearm anchored on the wall. Then Sean will turn his body to get a stretch right across here. A lot of times we see people who are just driving their shoulder forward. And the shoulder gets enough anterior stress between throwing, bench pressing, and those kind of things. And so we want the body to rotate away from a stationary arm. And you should feel it all across here. Again, hold it for 30 to 60 seconds, get into 2 to 3 minutes of stretching per side if you're trying to get mobility gains. Now we're going to show you how to do some soft tissue mobilization to your pec, and in particular pec minor, which can be pretty stubborn in throwers and overhead athletes. Sean, if you want to show them where that ball goes, you'll put it right there in the little pocket between your, what we call your deltopectoral groove, so kind of that groove right between your pec and your shoulder. Anchor it there, lean on the wall, and then you can just kind of work it around, moving your body on the ball. And you can work it to your heart's content till you feel like the muscle's loosening up or you've had enough torture for the day. All right, now we want to introduce a serratus activation exercise. So the serratus, right, protracts our scapula as well as upwardly rotates it. So that's going to be key for our overhead athletes and overhead lifters, Olympic lifters. And so he wraps that theraband tight right below his scapula. And then he's going to protract. And so he's not rounding his thoracic spine, he's more so gliding his shoulder blades out as far as they can possibly go. And once he gets that set, then he's going to glide his arms up. And notice how his forearms stay pretty vertical, and he's not letting them get pulled into internal rotation. So protract, and then push up. And now we'll demonstrate this on foam rolling. So again, he's giving a little bit of a forward lean. He's going to protract, get the scapula way apart, and then push in to the foam roller and glide it up the wall. All right, another exercise we like, or activation series, is Y's, T's, and W's, commonly used in physical therapy clinics all over the nation. We're going to point out a few pearls to look for in your athletes or your kids if you're trying out these exercises. So you can do it on the corner of a bed, you can do this on the floor, yoga mat. You can also do it standing with bands. And so, all right, Sean, if you'll bring your arms out, and then I'm going to bring them up to like the letter Y position. We're going to go elbow straight, thumbs up, and he's going to go down and then back up. Good, and then up and down. And then what we can do is we can slide them up even further into an almost an I position. And that gets a lot harder because the lats that are coming in here and pecs are tighter, and so this makes this position a lot more difficult. And so Sean executes this really well. A lot of times you'll see the forearm as they come up dump into internal rotation, and then that's a sign that you need to look at their pecs and lats and see what's driving that. If we swing out to the letter Y and go, the letter T, and go into a thumbs up position there, and then up and down. The thumbs up, while it doesn't matter a ton, I feel like helps emphasize external rotation. And so you can add weights, but generally speaking, if you're adding more than a 5-pound weight, you're adding too much. And then the letter W, we come up here, and then keep those elbows high, and then we're just coming back, and we're coming forward as far as they can handle. And again, probably 2-pound dumbbells are sufficient here, and Y's as well, 2 pounds. So that's Y's, T's, and W's. And great activation exercise and great to establish muscular work for sports, overhead sports, as well as overhead lifting. All right. Well, we're here to wrapping up now. Sean, any last words?
No, the only
Anything
thing
to
I
say?
just wanted to impart on everyone joining us tonight is that, especially if it comes to a throwing athlete or an athlete that is more specialized in an upper extremity sport, if you have any further questions on anything that we hit on earlier, I would highly recommend you reaching out to your school's athletic trainer, any of the therapists over here at Ironman Sports Medicine, and the doctors at UT Orthopedics to get maybe a little more advice, specialized advice based on how to present, maybe get a little bit of a checkup and see how that's going before we start trying to do anything crazy.
Yeah, and like you said, the orthopedic group is all fellowship trained and board certified and experts in their field, and likewise on the therapy side, the majority of our clinicians have doctorates and board certifications, and some have even done fellowship training. And so we're here to take care of you and answer your questions. You can find us or ping us via email. You can find more information out on the UT Orthopedics page or Memorial Hermann's IRONMAN Sports Medicine Institute page. And so we thank you for your time tonight. Look forward to hearing from you in the future.